Now to a national issue impacting you on a local level. With a new administration in Washington, D.C. comes a new budget battle where priorities are shifted and some recent cuts are hitting home for central Nebraskans. Local 4's Ian Mason is in studio with more. Ian.
The Trump administration is trying to save federal money wherever they can through the new Department of Government Efficiency, or DOGE. One of the things that DOGE is targeting is public grant money that the government disperses to local organizations and nonprofits, some of them which are now sounding the alarm because they won't be able to continue to operate with the budget cuts.
All of public health in Nebraska is living in uncertainty.
Cuts to grants have caused small health organizations across the state to scramble in order to help keep offering their services to the public in the same capacity they always have.
We don't know what our budget numbers are going to look like, and many of us are planning for the next fiscal year with an idea that we can not know what is coming down the pike.
That is Teresa Anderson, the health director for the Central District Health Department in Grand Island. She says that DOGE cuts have already forced her department to scale back offering crucial services like free or low-cost vaccines, but it could also lead to scaling back disaster plans.
We've reduced in part our immunization staff, so we have less folks here that are able to give shots. The other thing we're looking at is our emergency response plan, and we're not certain yet what that funding looks like, but it's quite likely that we'll have to make a cut there.
Health departments aren't the only ones suffering from cuts, though. Local nonprofits like Choice Family Healthcare, which is funded mostly through grants and donations, are also feeling that federal pinch.
We just lost another $95,000 last week in grants. As those build up, they just kind of compound upon themselves.
Choice Family Healthcare is a clinic in Grand Island and Kearney that offers family planning and health services to underserved communities. According to their executive director, Ryan King, this is the only way that many of these people can receive health care. Without the federal grant dollars flowing in, not only will this decrease the amount of care vulnerable people will receive, it also means a significant chunk of money isn't being pumped into the local economy anymore.
We bring in a lot of dollars into the community through the grants. And without those dollars, folks need to be taken care of.
The hardest part for organizations like this is that their budgets are being cut under the guise of waste, fraud, and abuse, which is far from where they say their funding goes.
We're very conservative with our fiscal management. We want to assure that the dollars that come into us actually make a difference in our community. So as we develop these programs and implement these programs, we also implement a set of measures that tell us and the public, this is what we did and this is what changed because of what we did.
The services we do, especially preventive services, are actually going to save your local community money, and it's going to save the federal government money. You pay a little now in terms of grants to keep people healthy, or you eliminate those services and pay for their care later when it becomes more expensive. At every dollar you put into these type of services, you end up saving $7 later down the road. When people are looking at, do we need to invest in this type of services? Either way you're going to. And so do you want to prevent things, or do you want to pay for it down the road?
The biggest fear of these organizations, though, is whether or not they have to cut staff, which could create a grim reality if funding cuts continue.
When we don't have the staff to communicate with them, and a school nurse calls us and says, what am I going to do with this child? Maybe we can't answer the phone.
The House is scheduled to vote on a $9.4 billion rescission package later today that includes many of DOGE's cuts. I've reached out to the Nebraska congressional delegation in regards to this package and will continue to track this throughout the day. Alyssa?
All right, thank you for that report, Ian.